Welcome to the third dimension. After 10 years of war, Yemen remains one of the world's worst humanitarian crises. An estimated 4 million people, 14% of the population, are currently displaced, most of whom have been displaced multiple times over a number of years. More than 18 million people are in dire need of humanitarian assistance and protection services. The risk of a large-scale famine in the country has never been more acute. And now, funding cuts and Israeli airstrikes are intensifying an already dire situation, according to international aid groups. For people across Yemen, the airstrikes are a deadly addition to a humanitarian crisis that has overwhelmed the country for more than a decade. To discuss this topic joins me Caroline Sekyewa, the country director of the International Rescue Committee IRC in Yemen. Caroline has over 20 years of experience in program leadership, development cooperation, and partnership management. Caroline, welcome to the program.
Thank you so much. Thank you for having me.
Okay. Now, in one of your previous statements describing the situation in Yemen, Caroline, you said Yemen now stands on a precipice, and without urgent support, we risk reversing years of hard-fought gains. Now, this precipice you talked about, Caroline, seems to have been aggravated by aid cuts and the airstrikes. What is your take?
Absolutely. Thank you once again for having me. So Yemen is currently facing the worst food insecurity situation in the world after Gaza and Sudan. The worst. As you correctly said, 18 million people are in urgent need of humanitarian assistance. Of these 18 million, 17.1 million are in urgent need of food. They're in food crisis. A food crisis leads to a nutrition crisis where children who should be nurtured and helped to take on leadership positions of the future are suffering from lack of adequate food. So we have a food and nutrition crisis. We also have a crisis within the health sector. The health sector is extremely fragile. It was very, very dependent on external humanitarian assistance to keep it running. However, with the funding cuts, the health system is also facing imminent collapse. Today, we had a presentation on the food security analysis, and the situation is dire. Already, people are have lack of adequate food and are using negative coping mechanisms to get by. It's a bad situation, and it is predicted to get worse unless something urgent is done, unless there's an urgent injection of resources to help the system.
Okay, so trying to describe the Yemen humanitarian crisis, of course, many humanitarian communities and agencies are doing their best to help alleviate the suffering of Yemenis. And one of these organizations is yours, the International Rescue Committee. Now, my question is, Caroline, would you give us a sense of the services that your organization is providing war-affected Yemenis?
Absolutely. So the IRC, the International Rescue Committee in Yemen, provides integrated health and protection services, as well as livelihood support to the people of Yemen. Our health services target primary health care, reproductive health, child health, including nutrition, support for severely acute malnutrition and moderately acute malnutrition, or the therapeutic feeding and treatment, as well as immunization. We support the health system by really supporting the Ministry of Health with payment of incentives and supporting the supply chain for drugs and other supplies for health facilities. For under protection, we target women and children. We have a women protection and empowerment program, as well as a child protection program and a migrant response. And within all that, integrated into all our programs, is livelihood support, which includes financial inclusion, skills building, just so that we can have people becoming self-sufficient. We work very closely with local partners because we're interested in sustainability and a particular focus on women-led organizations and women rights organizations. So we work across the arc of the crisis. We have an emergency department which deals with immediate emergencies, sudden onset crisis. We have a humanitarian response as well as early recovery, so that now we have a holistic package that we're providing for the people of Yemen.
Okay.
Last year, we reached 1.4 million people with our services.
Okay, okay. If we just go back to yesterday's United Nations Security Council briefing, Caroline, and Tom Fletcher, the Under-Secretary General for Humanitarian Affairs, said 17 million people face food insecurity, a number that could rise to 18 million by September without swift and expanded humanitarian aid. My question is, okay, how does the International Rescue Committee help in this particular regard, that is food insecurity?
In terms of food insecurity, the International Rescue Committee provides livelihood assistance. We also provide nutrition support. This is the prevention and treatment of child malnutrition, as well as support to pregnant and lactating mothers. The figure of 18 million is an alarming figure. So we are looking at a catastrophic situation should there not be any dramatic and immediate response. And these shortfalls, these funding shortfalls, will lead to a more expensive response, and all the gains that we've made over the years where we have been providing support to the people of Yemen risks being completely eroded, and people's lives are actually at risk of risk of people are at risk of dying.
Okay.
Yes, indeed.
Okay. So if we could turn to health services, Caroline, and you know that the war has completely depleted Yemen's healthcare system, okay? And the country is failing to prevent what we call treatable diseases like cholera and other diseases, okay? Now, today I read a report for your organization that the IRC is launching a strategy to boost childhood vaccination rates in Yemen in coordination with the Ministry of Health. Would you tell us more about this strategy or vaccination strategy?
This is a vaccination strategy called the Social Behavior Change Strategy, And we're very, very happy that the Minister of Health signed on, endorsed this strategy. And this strategy can be used by both IRC as well as other health partners to really reach out to families that have children who are not vaccinated against the common childhood diseases. As you correctly said, we are grappling in a cyclical manner, dealing with diseases that are preventable. So this strategy engages community leaders, engages health staff, engages partners who are involved in the health system to encourage mothers to remove the barriers, to help remove the barriers, especially barriers of misinformation and vaccine hesitancy, including how they are treated at the hospital, the cleanliness of the facility, how welcoming the facilities are, how accessible services are, in order to encourage mothers to bring their children to be vaccinated. So a lot of engagements have gone on with partners, with the Ministry of Health at different level, at district level, governor level, and also at national level, to just ensure that this strategy responds to what is needed in order to change mindsets, in order to remove the barriers to access to immunization.
Okay.
So there are a lot of children born every day in Yemen who have not received their first shots to prevent childhood illnesses, and we hope this strategy will really help us have a unified and concerted approach to help reduce those numbers significantly.
And your target provinces or governorates are in both areas, I mean in Houthi-controlled areas and in liberated areas. Yes, Caroline?
The strategy can be used across Yemen. IRC services are in IRG-controlled areas in Shabwa, Abiyan, Al-Dale, and Hodeidah and Taiz. But our partners are working across Yemen in both the Sana'a-based authority areas as well as the IRG areas.
Okay, this kind of operation or mechanism of work across Yemen brings me to the issue of major operational challenges that your organization faces, Caroline, especially in Houthi-controlled areas.
Absolutely, challenges exist, and I think that's why we're all here as humanitarian actors, trying to really reach the people who are most at risk, who are most in need of humanitarian assistance. So we take those challenges as part of our operational and make operational adjustments in order to cope. We also work alongside others. We work alongside the UN and other organizations, international as well as national, to really engage around the bureaucratic impediments and other access constraints in order to reach those in most need of our services.
Okay. So another area of your interest, Caroline, is providing protection to women, especially women, because we usually say women bear the brunt of any conflict. Okay, so would you just tell me briefly about what protection and empowerment programs does the IRC deliver to women?
Yeah, indeed, women bear the brunt of war across the world, and in Yemen in particular, in Yemen specifically. So at the IRC, we provide life-saving protection and empowerment programs. This includes opening up and managing safe spaces where women can come together for psychosocial support, to learn new skills, to get information, and things like that. While we are here, while they're in the safe spaces, they receive case management support, especially if they are survivors of gender-based violence and assault. They receive legal referrals, psychosocial support, and other health services in privacy, in a private setting where probably these services were not available in the conventional hospitals. We also support the community-based initiatives and work through women-led organizations. We empower them. We build their capacity, provide some funding for core operations so that they are able to also work with women groups, either in education, in livelihoods, and in providing at least health services around nutrition information, pregnancy information, reproductive health information, and things like that.
Okay. Now, if we could turn to another important issue within the debate of the humanitarian crisis in Yemen, Caroline, which is the attacks on civilian infrastructures like ports, airports, etc., something that deepens the suffering of Yemenis, okay? And let me remind you, on December the 31st last year, 59 organizations, including yours, okay, operating in Yemen, voiced concern of consequences of escalations on civilians in Yemen. Now, Caroline, this escalation is still now, especially, okay, reflected by the Israeli airstrikes on Hodeidah port, okay? My question is, what pressure mechanisms can NGOs play in this regard, okay, to stop such attacks on civilian infrastructure?
Absolutely. Attacks on civilian infrastructure disrupts immediate aid delivery. Attacks on civilian infrastructure takes us backwards in a country that is trying to recover from decades of war. It takes us backwards. Attacks on civilian infrastructure is also against international humanitarian law.
Yes.
These attacks attack hope, they attack stability, and they attack the future. These civilians have got nothing to do with the politics that causes people to fight. They are actually the victims, the survivors. They have not picked up weapons and they're not fighting. This disruption actually delays and impedes Yemen's long-term recovery. This is what I can tell all the actors to think about the human consequences of these attacks. And when peace does return to Yemen, we'll have to go all the way back to rebuild from scratch all the infrastructure that has been destroyed. That is extremely expensive. In the meantime, people will have died for lack of adequate health, for lack of water, because water infrastructure has been hit, for lack of schools and other safe spaces for children and women. Livelihoods would have been destroyed, and this is actually a moral. It's a moral wrong.
Yeah.
It's a moral wrong that everybody should be concerned about and work towards and have a dialogue towards reducing or eliminating these attacks on humanitarian, on civilian infrastructure.
Yeah, and if I ask again my question, Caroline, along with the humanitarian agencies, okay, the partners that are working on the ground in Yemen, okay, do you coordinate a sort of action, okay, to raise these issues to the United Nations so that, okay, those who attack Yemen civilian infrastructure should stop, and should stop now?
Absolutely. We work closely with UN agencies, international NGOs, national NGOs, through the clusters and through local partners as well.
Yeah.
And the message is the same. The message is consistent. Civilians are not a target. We urge all parties to the conflict to uphold international humanitarian law, protection of civilians and aid workers from these attacks. To allow full access to people in need, peace and stability must be prioritized over power and politics.
Okay. Now, if I could move to another point, Caroline, okay. Now, despite the giant efforts made by international or humanitarian communities there on the ground in Yemen, okay, some experts still say that Yemen has always been forgotten war, and it has vanished from our collective conscience. There is no champion for Yemenis, okay? This is Dr. Bernard Kosla, a professor of James Madison University and Yemen expert. He argues that international attention is still lacking in Yemen. Do you agree with him?
To some extent, yes, I agree with him. But also, we have to keep in mind that there are so many crises that are happening at the same time. And the two I mentioned at the beginning of this conversation, Gaza and Sudan, they've taken quite a lot of the attention, media attention, as well as political attention, because these are new conflicts. These are new conflicts, and the severity of the conflicts is the images are jarring and therefore top of mind for people. Active conflict in Yemen, apart from what is happening in the front lines and in the Red Sea, has been happening for the last 10 years. So this is not a new, crisis, and therefore media attention has shifted a little bit away from Yemen. But now, with the statistics that we are looking at, we are having to bring it back to the fore. And I was happy that the UN Security Council briefing yesterday focused on Yemen. There are senior leaders talking about Yemen. We are talking about Yemen. The donors are also rallying around Yemen. Yeah. And now that we have new statistics, emerging statistics, we're stepping up our advocacy and communication just to bring back the media attention and also political attention to Yemen, so that now that attention can also help us in our messaging around stopping the crisis and bringing parties to the conflict to the table to negotiate for peace.
Okay. With this, we come to the end of this interview, Caroline. Thank you so much for your time and insights, and thank you for talking to Yemen Today TV.
Thank you so much for your time, and all the best.
Thank you. That's all for this time. See you next week with a new edition of The Third Dimension.